Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer from Douglas County here in Oregon. It's Friday, October 23rd, and we're talking again on our Facebook Live. Again, by the Oregon rules now, you need to have a mask on if there's somebody else in the room with you. Our beloved producer just left, so I can take my mask off, and we'll do so. All right, Dr. Bob Dannenhoffer, the Public Health Officer from Douglas County. Welcome again for being here. We've got a lot of people who watch. Sometimes people watch as watch parties, which is an amazing thing to me. Again, this is a time for you to get questions answered. We're doing this a little electronically, so give us a little slack maybe. But it worked pretty well on Tuesday when we did it last time. Again, if you have questions, put them in the chat section and do it. And we also have a new mailbox called Facebook Questions. So if you just happen to think of a question in the middle of the night, if you email it to us at facebookquestions@douglaspublichealthnetwork.org. We were trying for the longest email address ever, and I think we got it. So facebookquestions@douglaspublichealthnetwork.org, and you can send the questions, and we will then include those in the next Facebook Live session. Also, next Friday, we're going to do a little bit differently. We've been doing this every Friday night now for 7 months. And so for, like 30 straight weekends, people have missed or started their weekends very late because they've done with us. So next week, what we're going to do is we'll collect your questions on Facebook at Facebook Questions at douglaspublichealthnetwork.org. And we're actually going to tape it at 4 o'clock. And so we'll tape it at 4 o'clock, but we'll show again at 6. The only difference at that point will be that you can't get live questions at that time. So let me start from the top. This has been a grim week. I've been predicting over the last few weeks that we're starting in the third wave, and I think it's very clear that that prediction was unfortunately correct. We are clearly in a third wave in the country, in the state, in Oregon, and in Douglas County. So with the world, we're at 42.4 million cases, 1.14 million deaths. Just a phenomenally active pandemic. When you look at the maps of activity, in the past it would be big in one country and then move to another country. Now there's almost no place in the world other than Australia, New Zealand, South Korea, Taiwan, and Hong Kong where this is not a very active disease. Still very active in the U.S., in Brazil, and India, and where I'm seeing just stunning numbers from France and the U.K. So France with 44,000 cases in one day. Now, France is a big country, but it's only about the fifth the size of the United States. In the U.S., we're at 8.7 million cases. We had 81,000 cases today. Now, Johns Hopkins and Worldometer, which are the two sources I use, lose slightly different numbers, but just a stunning number of cases today. If you go by the Worldometer number, it's the highest ever. So again, we had that first small peak, a big peak in the summertime, and they went down fairly low before Labor Day, and now it seems to be above again and again. 800, we're averaging 800 deaths, so the deaths had come down to the 600s and look like it may come down further, but it's now up again. And when I see stories on the news, and when I look at the numbers, places like Wisconsin are running out of hospital beds. We've done this doppelganger analysis where we've looked at Twin Falls, Idaho, and Pennington County in South Dakota, which is two counties. They're similar to ours. Twin Falls, they have now 44 deaths, 50 or 60 cases a day. 25% of their hospitals filled with COVID patients. They've stopped elective surgery. There's no visitors in the hospital. In Rapid City, they have 54 COVID patients in the hospital. So imagine Mercy, their hospital is about the size of Mercy. Imagine if Mercy had 54 patients. We're a little concerned now because they have 6, but imagine if there were 54 patients in hospital, 9 in the ICU, no visitors, no elective surgery. And so this, if we don't do better, is what we could be facing. Oregon also really struggling, 41,000 cases, 649 deaths. We had 550 cases today. And when I talked to the health officer from the state today, the question is, well, where does it all come from? They're not coming from anywhere in particular. They're coming from everywhere. In Douglas County, we have 3 new cases today and 1 new death that we reported this week of a man who died at home. Really tragic. This guy was sick, didn't seek care, and deteriorated very quickly and died at home. His test was positive for COVID, so he very clearly had COVID. Still a bunch of people in the hospital, some very, very sick people. And when we look in Douglas County, we've had about 40 cases over the last week, depending upon what numbers you're looking at, which days you're looking at. So still a lot of cases, far and away our heaviest week. And unfortunately, the cases are everywhere. There's 2 nursing homes, 2 hospitals, EMTs, 5 schools, the college, daycare, a bunch of restaurants, lots of family gatherings. So it's really everywhere, and this is really, truly the time to get this under control, because otherwise I think we're going to see, like what they're seeing in Twin Falls, like what they're seeing in Rapid City, like what they saw in Israel. So you remember, I got a lot of crap for this, because I compared our situation to Israel, and I said Israel has typically been, when you look at this curve, 3 or 4 weeks ahead of us. And indeed, they were 3 or 4 weeks ahead of us. In the middle of September, they had a huge rise. They've done a lockdown. They're just now coming down in deaths. They've come down in cases for a week or so, and they're going to release the lockdown. The concern was that we would start to see in, a month after Israel, that is the middle of October, we start to see a sharp rise in cases, and we've done that. Okay, we have a lot of questions already. So how many cases do we have this week so far? Again, depending upon how you look, it's going to be about 40. Now, when the state looks at the number of cases, it looks on what's called the morbidity and mortality week, which starts Sunday at 12:01 a.m. and goes to midnight on Saturday. Veronica says, what's the positivity rate now? Last week it was 4.6%, and it's probably going to be about that next week. So both the case count and the positivity rates are going up, and this is pretty scary. So Crystal says they want to give a shout out to the contact tracers. These are incredible. These are local people we hired. Some of them had some healthcare background, but mostly just good people. That's what we're looking for. People who could really contact and connect with others. And they really have done an amazing job to connect with others. They call, they help people get through quarantine, they answer questions. They certainly don't know all the answers, but who does? But they're really good at helping. And, people, I was on a call the other day. Believe it or not, I do a few calls in a day. And people said, well, tell me one good thing that happened this week. And so I'm going to make Vanessa blush a little bit. But, we were supporting a family in quarantine. They had a puppy that needed some kind of special dog food. And so, bless her heart, Vanessa went out, bought that special dog food, brought it to the family so that the family didn't have to leave quarantine, could stay in quarantine and protect others. That's the kind of wonderful things that our contact tracers are doing. Clarice says, has anything changed regarding face shields? Well, not really. The Oregon guidance changed. So the Oregon guidance used to consider face coverings and face shields to be equivalent. The CDC doesn't like that. The CDC is down on face shields, and they think you should go with face coverings. But I'm critical of that because they haven't really looked at face shields. And there's some really good data from China that eye protection is very important. So they looked at the people who got admitted, a lot of people in China wear glasses, and the people who got admitted to the hospital were much less likely to wear glasses than people who didn't get admitted to the hospital, suggesting that the eye protection may help. And face shields, not surprisingly, give you both eye and face protection. The CDC has been slow to consider any studies about face shields, and there's some out there that are actually pretty good. So the new Oregon guidance change was where face masks are preferred over face shields, but both are acceptable. Now, actually, the very best is to wear a face mask and eye protection. It turns out the eye protection doesn't have to be any special, just eyeglasses seems to be fine. And I guess that's not surprising. When you look at your eyes, they're this moist surface. They're just a wonderful surface where germs can come in, and they'll do that. And we think by wearing glasses, you stop at least some of the ballistic stuff. I mean, at the end of the day, when I clean my glasses, I see all these little spittle particles. So presumably, that's what's happening during the day. I'm not even seeing it, but it's getting on the glasses, and by wearing glasses, you can protect it. OSHA does have some guidelines for face shields, but they're mostly to protect your face from ballistic particles. So, as I've said to you before, I wear a face shield when I'm in the shop. So when I'm not a very good person on the lathe, but when I'm doing the lathe, there's frequently stuff that shoots up at me, and that's why I wear a face shield. So most of the protective face shields that OSHA requires is that they won't break when you get hit with a piece of wood. Well, that's not really important for COVID, because COVID's not going to break your face shield. And so my recommendation would be the best thing to wear is something. Wearing nothing, I think, is really not great. I mean, I saw a projection today that wearing face coverings could decrease over 100,000 deaths over the next few months. Now, those 100,000 deaths over the country are a bit diffuse, but those 100,000 deaths are people's brothers, sisters, mothers, cousins, and so I'd really encourage people to wear face protection. If you could do a face mask, it's better than that. Both is best. So, what is the quarantine thoughts on someone who's living with somebody who's been exposed? Should the person living with them also quarantine? So let me get the story here. So, and we'll use one at our house. So my wife was exposed to somebody who she thought had the disease. So she quarantined, meaning that she got this own room, different from our usual bedroom, stayed in the room. Every day I brought her breakfast, her lunch, and her dinner. When I was out of the house, she could leave the room, but when I was there, she stayed in the room. I could continue my regular activities because I was not exposed to that person. So she was the contact, and she had a quarantine. I was the contact of a contact. I did not need to quarantine. So is there an outbreak at Timbertown Assisted Living? If so, were they residents or staff? Well, it's going to get reported, and the answer is yes, there's been an outbreak at Timbertown, and it was both residents and staff that were affected. I don't know the current number right now. They did a lot of testing on Wednesday, and the testing was coming in just this afternoon as I was leaving the office, so I do not know the numbers. So Laura says, at what point do we get before school shut down again? Well, this has been my week. So my week has been people sending me really, really, really passionate emails that schools must open. At the same time, we're seeing these increasing cases. So I don't really know if when you write emails, you send all caps, it's yelling, but I think it is. I have so many things questioning my motives. I don't care about people. I'm heartless. I don't give a damn and whatever. I mean, really, guys, could you? And these are not from people in Douglas County. These are people from all over the state because I'm on this state healthy schools reopening thing. None were from Douglas County. Thank you. You've all been kind. But I will tell you, some of the people from around the state have been incredibly ugly. And so, yeah, so we're at the same time, we're talking about relaxing things to open schools. At the same time, we're seeing a big increase. Now, I will tell you, we've had now 5 outbreaks in schools. All of the outbreaks have occurred from people who got the disease outside of school, and then in school it dead-ended, so it didn't spread to any other people in school. And that's kind of what we thought would happen. But still, that's a lot of outbreaks. I would much rather than shutting down schools, I would much rather shut down other higher risk activities. I live around the corner from a very well-known bar here. So many people in there. That's the place where I think this can really spread. So Alia says, I was told that face shields were no better than nothing at all, basically a placebo. Is that true? Well, it matters who you talk to. Again, if you look very carefully on the CDC guidance says just there's no data. Well, there's no data that they like, but there is data out there. And actually, I think face shields I think there's some data that face shields do work. There's a guy in Iowa that has looked at this very carefully. And they do think it's worked. So it's clearly not a placebo. Clearly, in terms of me spittling at you when I'm wearing a face shield, I don't. The question is whether it protects me as much. Maybe not. But again, even aerosol particles don't tend to go up very well. And so that's it. So Veronica says, what 5 schools? I thought it was 3. So you remember you started off with Sutherland, first grader, didn't go anywhere. The second was there was about 2 weeks ago somebody down in South County. This week then there were 3 outbreaks, 1 in Oakland and 2 in Winston. So Casey says, how do you respond to educated people who promote herd immunity? So herd immunity is what you did in times when you had diseases that you had no hopes of controlling. So measles is a great example, really very infectious disease, pretty nasty disease. About 1 in 1,000 people die. About 2% of the people, or about 20 in 1,000, really very sick. All kinds of other things that happen from measles, so really a bad disease. But when I was a kid in the 50s, I know that seems so long ago, but when I was a kid in the 50s, there was no treatment for measles. There was no vaccine for measles, and there was no vaccine really even on the horizon, because we had no idea how to make a measles vaccine then. And it was so contagious that it was really hard to stop. So at that point, we made the kind of arrangement that we were going to just have measles just happen. And so what would happen is young kids would get measles. Typically, when the first few years they started school, they'd be sick for a week or 2. Some would get hospitalized, some would die, but then they would get long-lasting immunity, and they would do it. So what we did then is we built up to the point where, if you look back in 1956 when I was born, and you sampled people for measles, almost everybody who was 10 and above had measles immunity. So you may have wondered, if you're older and you're in healthcare, you don't need a measles shot if you were born in 1956, because they assumed that everybody who was born in 1956 was exposed at some point. But 3 things with that. One, with measles, is there was no hope for a vaccine. There was no hope for treatment. There still isn't. And it gave very potent, long-lasting immunity. There was almost no one who's had measles twice. So that was what we did then. That's basically what the people who are suggesting herd immunity suggest we do now, which is to let it go, not to do any special precautions, not to really do any testing. If somebody gets sick with it, put them in the hospital and treat them there, but otherwise not to do anything else for except what they call the vulnerable population. And the vulnerable population is a little hard to know what it is, right? Is the vulnerable population people over 60 or people over 70 or people over 80? If you take people over 60 in Douglas County, it's about a quarter of the population. And then if you say the vulnerable population is people over 60 plus anybody with underlying conditions, about 50% of the population. And so it's a little hard to know. In our country, we have many multi-generational families. It seems like maybe a quarter of the kids I see are living with grandparents. And so that there are kids then with grandparents, pretty hard to separate those. And just the way we do our society, young people take care of old people. They're the ones who work in nursing homes to take care of older people. So what they say is just let it sort of burn through, and then some old people, we'll try and protect the old people as best we can, but we're gonna wind up with more cases, and we're gonna wind up with more deaths. But that's really the way we should do it, because it's really the only way we can make it happen. Well, I have to take great argument with that, and the reason I have to take great argument with that is that it is going to be incredibly hard to protect the seniors, right? I mean, who are you going to get to work in nursing homes? Who are you going to get to work in hospitals? Who are you going to get to be a public health officer? I mean, I'm 64. I mean, who are you going to get to do all those things? And the answer is, I don't think we can. And then how are you going to really protect those seniors? Are we going to hire an army of people who will deliver food, clothing, groceries, pet care, lawn care, and whatever to seniors who shouldn't be out? They talk about this in one sentence. We should provide services for seniors, but how in the world that's going to happen, I don't know. And so, the concern that's out there is that if we do this, there are 3 things. One is, there really is a vaccine right around the corner. And won't we feel absolutely stupid if the vaccine is around the corner and it's really quite effective next year and it's out next year? All of those deaths that we've had before then, you don't get back. The second thing that I worry about is that other treatments are going to get better. So the president touted this Regeneron antibody cocktail. I'm not sure how well it works, but right now there's not very many doses. By the springtime, there's going to be lots of doses. So if we can wait till the springtime, we'll likely have it. Remdesivir was just approved, and I'm really hopeful that there's even going to be like a Remdesivir 2, which is even better than Remdesivir, that really will help. So we've got a bunch of things right on the horizon, and my sense is that herd immunity is akin to surrender. Say, okay, we're going to give up, we're just going to let it go through. Now, if you could show that anybody ever did this successfully with a respiratory virus anywhere ever, I'd love to hear it, but nobody can show that anybody has ever done it. And certainly to do it in such a complicated society as ours is really problematic. Now, there are some well-known people who signed on to this. And they signed on to it because it says you want to do focused protection for the old. And I'm all for that, right? I'm totally all for everything we can do to prevent seniors, to protect seniors. And we're not doing enough, right? My mom should be able to just, she's 90, she should be able to just call up and say, lawn service, can somebody come and do my lawn? Can somebody deliver my groceries? Can somebody go ahead and do this? But we just in our society don't do this, and the people who've suggested this have no real solutions for all the time and other effort it would take to do that. So I'm just shocked. If you want to read it, and I've read both this Great Barrington Doctrine, and they call it Great Barrington because it was signed in the city of Great Barrington. But basically, this was done by a libertarian think tank. So you've heard of the Koch brothers, who are very much libertarian, and they got all these political views. It very much follows their view that that this wave should go. And it's couched in, well, this is unfortunately the way we've done it with lockdowns. We've really been hard on poor people, and indeed we've had. But in fact, in this case, we'd be even harder on poor people. So, so that's what I think about herd immunity. I think the best rebuttal to that is in the New York Times. There's a guy named John Barry, who's really a great author, who wrote a book called The Great Influenza, which talks about the influenza in 1918. And he just basically shakes his head and said, this is crazy. There's going to be another 500,000 deaths in the U.S. And for every death, you have 20 people who are pretty sick and sick for a long time. So a friend sent me something today, somebody that they work with up in Alaska, 20-year-old, who was, got COVID, like, I doesn't get over this. Well, months later, still very sick, unable to exercise, unable to move around, back to the hospital a few times. A very, very long and complicated illness for them. And in fact, when we look at those people who had it early on, most of them are not well yet. And so this is not just about the deaths. This is also about the people who have the disease. So, all right. So if you have the flu, does the test show this? There are so many varieties. How is this determined? Great question. And so there are two kinds of flu tests, three kinds actually. One is a viral culture. We don't do very many of those anymore. There's a PCR test that looks for the specific DNA of the virus or the specific nucleic material, it's RNA, of a virus. And then there's the rapid antigen tests. The antigens are slightly different between A and B, so that the antigen test can distinguish between A and B. The PCRs and the cultures can tell you exactly which virus it is. They're pretty good. Linda says, did our governor outlaw face shields? No. So again, face masks are preferred, but face shields are still acceptable. I think this is the right way to go. There are people who just cannot put a mask on their face, and if you outlaw face shields, then what are they going to do? I would certainly, and people have written me some really heartbreaking stories. There's this one woman who writes about being smothered and had something pushed on her face to kill her, and she survived. But can you imagine the horror of putting a tight-fitting mask on? Must be tremendous. And for her, wearing a face shield is an alternative. So I think we would do that. Can you tell us the regular flu and hospitalizations was in 2019, 2020 locally? I don't have that specific number, but it's very low. I worked at the hospital for many years, and in the 2009 outbreak, I was working there in quality. That was a bad outbreak. We had a lot of flu cases. I had like 2 in the ICU at a time, maybe 2 on the floor. Not a lot of people in the hospital. Certainly not like you're seeing in Rapid City, South Dakota, with 54 patients in the hospital today. Deborah says, can I say which child care facility had an outbreak? It was in the newspaper today. It was Cobb School. And it actually wasn't an outbreak, but it was a worker who got infected, not at Cobb. And so what happens is people who work at child care centers, at hospitals, as ambulance drivers, as public health officers, have outside lives. And in almost all of these cases, people get the disease in outside life. They don't know they're sick. They go to work, and then they find out they're positive. Yeah, Betsy C says, what can Roseburg do to get the message out to non-believers? I'm seeing more and more noses and no masks out and about. Well, yeah, I don't know. I mean, if people have suggestions on how to get the word out, I think what we've had, though, is we've had so much back and forth on this. So remember, early on, our Surgeon General said, guys, don't go out and buy all the masks. The hospital workers need them. We don't know that masks do any good for you, so don't go ahead and do them. What people interpret that as don't ever wear a mask. Well, later when the data came out that masks were helpful, then it took on this political realm, and it still takes on this political realm. This Dr. Scott Atlas, who I just don't get, wrote on Twitter this week, masks don't help. Now, I don't know how he can say that if he's looked at the literature. So Barbara says, how many people equate an outbreak? This is really complicated. Oregon has made it complicated. Workplace outbreaks, and Kristen is doing so she can correct me if I'm wrong, but for workplace outbreaks, if you have more than, there's a threshold for when you report a workplace outbreak and then when it gets reported to the public. So the threshold for reporting to the public is a business with more than 30 people have more than 5 cases, either in the facility or secondary. In schools, it's 1 case, and you don't count the secondary cases. At long-term care facilities, it's 1 case. And so it's different in all of those. And actually, we'll write this out for you this week and get it there because it's confusing even for me. So Lori says if we have another week with above 33 cases with schools in Douglas County currently running in person, have to shut down. Well, I think there's going to be some changes in the metrics. So the school metrics were made very early. Oregon was the first state to publish metrics, and the metrics were really quite conservative. And then what happened is, because it was new stuff, there were all these rules and exceptions and double exceptions, and it got super complicated. So I think there's a move to go ahead and make it. So I think there's a move to make it clearer, and I think you'll see that in the next week. So Kristen says, for childcare, it's 2 cases. For schools, it's 1. For congregate care, like long-term care facilities, it's 1. And for workplaces, it's 2. But to get reported to the Oregon Health Authority, it's 5 cases in a business of 30. So complicated. So with the outbreak at Timbertown, should those with loved ones at Timbertown or Chantel's be concerned? I mean, we should all be concerned, but I think both of those places have done a very nice job with infection control. Again, these things are going to happen. The people who work there are young people who, like my kids, go out, go with friends, do kind of things. And it's not shocking that some of them will get sick. And the way this virus works is that you tend to be really quite contagious in the day or 2 before you have symptoms. So, you live your life. You're not symptomatic, but you're infectious, and you do what you're supposed to do, which is go to work. And you can then spread it to others. And so that's what we were about. So what are the exact numbers Douglas County is using qualified for school opening and closure? Again, I spent 5 hours today on phone conferences with OHA, ODE, the governor, everybody else, and then with others and all of these nasty emails. And I will tell you, it's really up in the air. I think next week our number is going to be in the get ready to close, but I think by the time we see it, there'll probably be a change. So Veronica very rightly points out, thank you. The problem with herd immunity is that we also don't know how long immunity lasts. Exactly right. And I should have mentioned that before, but with with measles, we knew that you got it once, you'd never get it again. With this one, we do not know if you get immunity, and we do not know how long it lasts. Let me tell you some scary stories here. So there are 3 very well documented times where people got infected again. In those cases, they actually had the virus from the first time and the virus from the second time, and they could compare the genetic code, which is just an amazing thing. But they could compare the genetic code, and they had it again. But the number of people who said, yeah, I had this back in March. They didn't save the virus. I got it again this time, so we can't really compare it's the same virus. There's hundreds of those cases where people got it, were well for a while, and then got sick again. So if you go back to the Teddy Roosevelt, which is the aircraft carrier that was there were 13 of the 1,000 or so people who got sick, they got better. They were totally better. They had 2 negative tests, and then they got sick and had positive tests again. So at least in them, they did not have long-lasting immunity. Now they thought, well, maybe you get it bad the first time and get it less bad the second time. Well, in many of these cases, the people the second time are much sicker than they were the first time. If that's really true, now, of course, those are the ones you'll hear more about, right? The person who got it really bad the first time and just had a little the second time doesn't make much of a news story. But if you were not very sick the first time, second time you're hospitalized, that does make the news. And there's hundreds of these cases. So there's no sense that there's no guarantee that there's going to be long-lasting immunity. And won't the people for herd immunity feel a little silly if we go ahead and do this and find out, that's right, there isn't long-lasting immunity. All of these cases we've had are basically lost because they're going to happen again. So Jane said, I read today that COVID is now the 3rd leading cause of death in the U.S. behind heart disease and cancer. Indeed, it is. And so it is the 3rd leading cause of death. We've had about a 20%, so some places have had as much as 20% increase in the number of deaths in 1 year. Overall in the country is about 10%. It's pretty terrible. So Mel says the director of the WHO has said that letting herd immunity happen naturally is moral bankruptcy. That's more poetic than I am. But yeah, I think it's a surrendering without getting any terms of surrender. I mean, it to me seems crazy. Now, if you had no place in the world that was successful, right? Every place looked like Italy in March. Every place has had this. There's nothing you could do and whatever. Then that may be a reasonable strategy. But at the same time, every day, I look at all the numbers every day. I'm just sort of a nerd in that way. I look at the numbers in Australia, China, New Zealand, South Korea, Taiwan, Hong Kong. Less than 200 cases among them. Put them all together. Less than 200 cases, some whole weeks without any deaths. So not only do we not know about whether there's long-lasting immunity, we do know that with some reasonable things you get this done. I mean, Australia and New Zealand are strikingly like the U.S. Now, sadly, I've never been to New Zealand, but my wife has, and she said it's strikingly like Oregon. It looks like Oregon. People are nice like Oregon. The roads are narrow, but it's a country. I mean, these are not people who are either supernatural and can get something special done. They just have worked together to get this done. And when I see the low numbers in these countries and then see what's happening here, it really can be done. And so I think we should. So Linda says, did you see that Costco is selling the saliva test? I haven't been to Costco in a while, but yeah, the saliva tests are out there. I think saliva tests are going to be great. Early on when they were doing this, they did nasopharyngeal swabs because most viruses live preferentially in the nose and not much in saliva. And so when you get a test started, you do what you know, which is the nasopharyngeal swabs. Since then, what they've looked at is scientists then have looked to see where this virus is, and not surprisingly, there's a lot in there's a lot of this virus in saliva. So now some of the nasopharyngeal tests are being retrofitted to doing saliva, and this is going to be great. So you remember back, it was as early as March, I said what I wanted for Christmas this year was a saliva test. And so the saliva test, spit in a cup and get the result right away. Unfortunately, the saliva tests that are out there now are all PCR tests. So you spit in the cup, close it up, put it in the cup, send it away, they run the PCR and get it back. So it's expensive and it's not quick. So it's not exactly what I was hoping for Christmas. Because what I was hoping for Christmas was a quick, easy one I could just do on the side there. Although the new Binax tests are really pretty good. They work in the anterior part of the nose. You do get the results in 15 minutes. They are less than $5. Not bad. So Zay, sorry, I kept calling you Zach. Zay says, can you get a flu and pneumonia vaccination together? Yes. Jeffrey says, can a company terminate your employment for not having a medically backed reason for not wearing a mask but able to wear a face shield? Well, companies do all kinds of crazy things. But according to the guidance, and you can find it on the Oregon Health Authority site, that both are acceptable. Face masks are preferred. So this is Zach, says, what are hospitalized patients at Mercy under care for? Respiratory problems? Yes. So almost all of the people who've been hospitalized have respiratory problems, ranging from needing oxygen to needing to be ventilated, needing to be on a ventilator. So they all have respiratory problems. In fact, the hospital is not admitting people if you've just got aches and chills and whatever, or even if you have a little bit of a need for oxygen, you have to have really significant oxygen need. So that's problematic. So how long have the saliva tests been out long? Yes, they've been out for a very long time. And it's not exactly clear to me why it's taken so long to be ramped up. I have no idea about how much they cost. Any more information on pool testing, it'll be something that'll be available soon. So pool testing is already available. So what pool testing is testing where when the rates are low. So when there's, let's say, just a few % of people who are positive, what you could do is, rather than run 100 tests, you could put, let's say there's 100 people, and the rate of disease is 1%. So if you tested everybody, you have to do 100 tests. If you tested 5 groups of 20, one of those groups would be positive, and then in that group, you tested all 20, you'd have to do 26 tests to test the whole group, and thus it speeds it up. So pool testing is already being done. It's actually best with saliva, so that's why I'm excited about saliva. It's really an issue for the labs, right? They're running less labs to get the same results. It really is not a big difference for people because basically your sample is going to get pooled with others. So we've done pool testing in the past, especially like for HIV, when the rate of HIV was 1 in 1,000. Rather than doing 1,000 tests, you could pool them in bigger groups and test a lot more people with fewer tests. I understand that it's how the Red Cross does blood looking for HIV and other things, since the rate of those things among blood donors is extremely low. Rather than doing every test in every person, they use pooled, which is just as effective and really saves on tests. So Tabitha says, how do you know when you should get tested and when it could be a common cold? Yeah. The answer is, if you have symptoms of COVID, fever, cough, shortness of breath, sore throat, runny nose, cough, you should do it. There's no way for me to tell. So many of our people that have had COVID for a while and have continued to spread it and saying, I just thought it was allergies. I just thought it was a sinus infection. I just thought it was a sore throat. And so I don't think you can tell. And now since we have the Binax tests and they're available, if you're sick enough to if you're sick, you should stay home. If you're sick enough to stay home, you should get tested. I think that's quick. So I'm finding here that the Costco saliva test is $129 to $139. Yikes, you're not going to do that very often. To really do this on a daily basis, it'd have to be down to $1 to $2. So what are other countries doing to control the virus? Great question. So what they are doing, it's not all the same. Almost all the countries that have been successful while there's any disease have been very good about wearing masks. In this country, not so much. The second thing that the other countries have done is that they are very careful with travelers. They know this moves from place to place, and what they've done is that they imposed quarantine restrictions on travelers arriving in the country. So they stopped travelers for a while, and then they put quarantine on those. So if you went to Australia, you had to quarantine for 2 weeks, and then you could go out and do whatever you want to do. But for those 2 weeks, if you broke quarantine, there was some huge fine, and the police arrested you. They were really, really draconian about that. That really helps because, again, people who come from high-risk areas are the ones who are likely to bring in disease. They do a lot of contact tracing. So contact tracing means when there's a case, they find the contacts, they get the second level of contacts. And I'm told that in Australia and New Zealand that people are incredibly cooperative at doing so. So when there's a case and a secondary case, it's like, it's my civic duty to go ahead and work with contact tracers. We have been great in Douglas County. People have been incredibly good in Douglas County. But a study came out last week from North Carolina that most people wouldn't answer the phone. Most people, they answered the phone, wouldn't do the interview. The people who did the interview wouldn't tell them that they had any contacts. And then the contacts wouldn't answer the phone. So in the United States, contact tracing has gone really badly in many places. Actually, Oregon has gone a little bit better. Douglas County has gone great. Some of the areas have done a tremendous amount of testing. So what South Korea did was, there was this big church that had, they tested all 5,000 members of the church using what we kind of use the Binax. They were doing this back in March. So they had the Binax kind of test. It wasn't the same test, but similar kind of test back in March. And so they tested bunches of people. When there was a case in the neighborhood, they tested everybody in the neighborhood. So they were very, very, very aggressive about testing. Now, they've done other kind of things too that we might not feel comfortable with. So apparently in South Korea, they can track everybody's phone. And most people pay things with credit cards or with a phone. And so they can track where you were. So there was one patient who spread it to lots of people at this mega church, and they could find out where she was and who she spread it to because they could track her phone. I'm not sure we could do that in the United States. And then the other thing that they've done is they haven't wasted a lot of energy arguing about this. We have used a tremendous amount of energy in this country arguing about masks, a tremendous amount of energy arguing about herd immunity, a tremendous amount of energy arguing about whether Fauci is idiot or not. And so we've wasted a lot of energy in doing that, and I think we're seeing this now with some pandemic fatigue. But, Australia's back. China's economy is totally open. Now, they're testing like crazy, and they find 8 cases in a province, and they lock down that province and get everything until there's no more cases. Then they test millions of people. So they've really been very aggressive in these areas. So when we talk about contact tracing in many of these areas, we in Douglas County have 30 people doing contact tracing, which is the most per capita of almost any place in the country. They would have 200. So they would have these teams of 5 go out and search things out and find the cases and the contacts and whatever else. They were very aggressive, and they were very aggressive on lockdown. We had lockdown light. Still a lot of things were open. When they did lockdown, you were allowed out of your house for 30 minutes each week. So these places that have done it have been much stricter in what they've done. They've wasted a lot less time arguing about it, and they're starting from a lower level, right? So, 8 new cases in South Dakota would barely be noticed because there's so many cases happening every day. So you can only get successful in this once you bring the cases way down, and now you can actually find the cases. So that's what happened. So Evelyn says, my husband had COVID in March. He is still struggling with exhaustion and memory and is 70 years old. How do we increase his energy and memory? Do you have any suggestions? Unfortunately, I do not have any medicinal suggestions. So there's no medicines that are out there that we think is going to make a difference. But this story, and it's such a heart-rending story, is that this is what we see again and again. So again, this 20-year-old who's still very sick, or this it was in the Register Guard. It was this young woman who was a collegiate middle distance runner. I mean, probably the healthiest people around. Still very sick months later. We do not have a good way to do it. Most of the people do get better in time, and so lots of TLC, mild exercise, doing Sudoku, staying mentally active is about the best we can do. But it's pretty weak. So Melissa says, how long do aerosols stick around in a poorly ventilated room? Will a mask protect against lingering aerosols? So I think so aerosols you can't usually see, but I think the best analogy to aerosols is wildfire smoke. Similar kind of particles that stay in the air for a long time. And again, masks clearly help with wildfire smoke. A well-fitted N95 mask really helps, and it can stay in the air for a long time. We think that smoke stays in the air a little longer than these aerosols, because these aerosols have to be a little bit wet, because once virus is dry, they die. So they probably stay in the air for a while. Now, some of it also deals with the number of air changes. So a great study that was done this last week that looked at in airplanes. And so what they did is they sprayed little particles and virus things around an airplane. Airplanes which, while you're flying, have phenomenal amounts of air exchange, 15 air changes per hour, as opposed to many houses, which is less than 1 per hour. And what they found was that even if you made a lot of aerosols, they got sucked in by the system and they didn't really spread to others. So poor ventilation is going to also be the issue. So aerosols in a poorly ventilated room, I think the rule of thumb is 2 air changes, so that if you have a poorly ventilated room and you only have half an air change an hour, it could stay for a couple of hours. Whereas if you had like the airplane at 15 air changes per hour, probably less than 10 minutes. Yeah, so Nancy says, what do you think will happen with COVID? Thanksgiving right around the corner. I don't know. I really worry about it. With flu, the flu bug loves Thanksgiving, right? So flu comes into this country typically in the ports, gets spread in the cities, a little bit in October and November, then comes Thanksgiving, and people move all around and spread this all around, and then it really, really gets spread. And so that's a real worry. I heard somebody who's very knowledgeable about this yesterday talk about, Thanksgiving is my favorite holiday of the year. Everybody gets together and they make these great things. But this year we just can't do it because of the fear not only of getting it from there, but also bringing it there to older, sicker relatives. Lots has been said about China, but it turned out that so China doesn't celebrate Christmas or Thanksgiving, but they do celebrate the Lunar New Year, which is the end of January. And one of the interesting parts about this is that this virus really started spreading in mid-January, and late January was the Lunar New Year. And in China, that is basically a combination of our Thanksgiving, Christmas, and New Year's. Lots of travel as people go to their relatives. Many people in China work away from their families. So a young family may move, the young parents may move to the city to work in the city while their kids are being cared for by their grandparents. And so they may only get to see their kids a few times a year. And a friend of mine who'd lived in China for a long time says it's like a combination of Thanksgiving, Christmas, New Year's, and summer vacation all at once. And so this happened right before the Lunar New Year, and actually China made the incredible difficult decision to shut down travel around the Lunar New Year. Still, some people got out, and that's what caused the initial spread in China. But they did a very good job of tamping it down. So there's an outbreak at Timbertown. Will they be testing at Chantel's? I do not know. There was a call at 3 o'clock today that I wasn't on, and I don't know. Do people who already have COVID need to wear masks? Who have already had COVID need to wear masks? Yeah, I don't know. So the question is, how long is your immunity from this? We don't know. We think probably 3 months. So yes, maybe if you had COVID and are no longer infectious, you could maybe go for a while without masks. So Kenner said, if urgent care said, I'm dealing with a viral issue, no fever, is it safe not to worry about it not being COVID unless I have more symptoms? Well, all these things are in a risk thing. If you said you had fever, short of breath, and shortness of breath, and then had been around somebody who had COVID, your chance of having COVID is very high. If you've not been around COVID and have no fever, none of the other symptoms, but just maybe feel a little stuffy, your risk is lower, but clearly not zero. So I think the new way to do this is that, if you're sick enough to go to the doctor with an acute illness, probably should get tested. And they're so easy to do. I mean, we just got another 5,000 of them, so we have 5,000 sitting around, and we've distributed them to the clinics. They're free, so there's they were bought with CARES money, but there's no charge to the clinics or the patients. So unlike the Costco test at over $100 that takes a few days to get, this test takes 15 minutes and costs nothing. So we need to get more people tested so we can tell out who are the people, because you may be like a good citizen. You go to the doctor and you think this is COVID. It's not COVID. You should be fine to go back to work, and you do, and it really is COVID. And then you spread it to your coworkers, your family. You'll feel terrible. So best to know. And again, these tests are easy to do. They're not the deep brain biopsy kind of tests. They're just in the front part of the nose. So when I work a lot with students and residents. So when I work with students and residents, I really, really try for them not to do a procedure the first time on a patient. So the first time they draw blood, the first time they put an IV, the first time they do a nasopharyngeal swab, the first time they do the anterior nasal thing, they really shouldn't do it on a patient. I mean, it's really not particularly fair for you to be the first patient doing it. So I always have them practice on me. And so one of the residents practiced this deep nasopharyngeal swab the other day. Really memorable. She did a beautiful job, but still. And then somebody did an anterior nasal swab. Again, much less painful. I mean, it really is sort of like putting a Q-tip in your nose. Not a big deal. So again, get a test. Now, the urgent cares are using a different rapid test, so they're not using the Binax. The Binax is available to them, but they've chosen to use other very good ones that they've already bought. Okay, a few other things. Remdesivir got approved for as a treatment. Wish it was better. Probably decreases length of stay, maybe decreases viral load, may or may not decrease mortality. The WHO study suggested it did not have a lot of people in it. The US study that had fewer people in it, there was a trend towards decreased mortality, but not statistically significant. But not a lot of side effects. So that's a good thing. The AstraZeneca trial, which had been stopped because of the transverse myelitis in England, has gotten restarted, so that's a good thing. And we should hear a lot more about school reopening. Okay, so Barbara says, I was tested yesterday. They said the results won't be in for 3 to 5 days. Ugh. Yeah, well, that's a problem. So again, the PCR tests, which are the ones which are the most accurate, are also the slowest, right? Because you need to collect them. They need to go to a lab. You can only do a certain amount at a time, and it takes a while to do it. They use very expensive reagents, really expensive machines, and so it's a slow test. Depends upon why you got tested. So if you're getting tested because you're asymptomatic and have been in contact Waiting 3 to 5 days is not a big issue because it doesn't need quarantine. If you're traveling, they'll only accept PCR tests, so you've got to do a PCR test. Or if you need a really important reason, like you're going to have a liver transplant, like one of our patients was, then you want to be really sure that you either have or don't have the disease, so you do the PCR. But if you're symptomatic and otherwise low risk, boy, these new tests are great. I'm not sure if they're been dispersed yet in Albany. So Casey says, why aren't we hearing more about what is happening with COVID in India and Africa? What is happening with the billions of poor people that can't isolate? Well, from a global perspective, this is a big concern. I mean, we're really focused on what's happening in the U.S., but we're a pretty rich country. We've got a lot of resources. We live relatively in huge houses in comparison to what happens in India and Africa. What we've seen in India is a tremendous number of cases. Now, India is a big country, and we still in the U.S., with about a quarter of the population, have more cases than they do, but it's really, really spreading in India. And in India, there's been a long history of great income inequality. And again, most of the disease is in poor people in India, and now it's starting to spread into other areas outside of Mumbai. And so it's really worrisome. Africa, we don't know about. I looked at Africa today. Very, very few cases in Africa, except in South Africa. So South Africa, the country at the very bottom of Africa, is wealthier than much of the rest of Africa, and maybe a little bit more westernized. And they've done more testing, and they have sort of a worldwide kind of average number. We do not know what's happening in these other areas. They have very little testing. So you look at places like Nigeria or places like Kenya, they have very, very, very little testing. And it is very hard to know if they have disease or not. In these places, they have measles and tuberculosis and lots of things. So people dying of respiratory illnesses is not that uncommon. And so one of the big questions that's out there is, when you go to these poor, very densely populated countries, is the disease there, and it just looks like the poverty and underlying disease they live with? Or is it really not there because there's not that much travel in and out of Africa? That is a total unknown. Okay, Kristen says in caps, it is 6:58, which is, it is, and it's time to go. So again, this is Dr. Bob Dannenhoffer. We'll do this again on Tuesday. Again, if you have questions that you think of over the night, you just put them there at Facebook questions at douglaspublichealthnetwork.org. We're going to be live again next week at Tuesday at 6 o'clock. On Friday, we're going to actually do the taping at 4, and so it'll be on at 6 o'clock on Friday, but it won't be live. So if you have questions, please get them into us before 4 o'clock next Friday. But again, next Tuesday, we're going to do it just this way. This was great. Actually, thank you, Kristen. You're fabulous. So I always have to do gratitude. So I talked about Vanessa and the wonderful thing that she did with that thing. But Kristen, she is great. She is at some point going to be our next public health administrator, I hope. And she is just a supremely talented young person who I feel really comfortable turning over the reins to at some point. All right, again, this is Dr. Bob Dannenhoffer, Public Health Officer of Douglas County. Be safe and be kind. Thank you.